Every year, a lot of mothers die due to pregnancy-related causes. These causes can be direct as well as indirect. So sometimes these are investigated in detail by the practitioners out there, and sometimes they are just overlooked. But they have their significance. Why do mothers die during pregnancy? What are the causes behind it? That we'll be discussing in this section in detail. First of all, just to get an overview, we'll be just discussing the definitions, which are quite important whenever we are discussing these maternal deaths in detail. Now, the statistical measures, on the other hand, are also very important whenever we are carrying out. A lot of researches, of course, are being carried out by different practitioners out there. Working in the fields, and that are very helpful whenever we are causing or whenever we are calculating the deaths which are related to these pregnancy related causes. The maternal mortality, they have their own ratios. For example, it can be the MMR, that is the maternal mortality rate, and then there can be a maternal mortality ratio. So these are basically important whenever we are carrying out a research for these maternal mortality causes and their significances, and whenever we are carrying out a research related to all of these terminologies. Now, the therapeutic abortion is of course carried out whenever we are working on the fields. You'll come across a lot of causes in which you're going to carry out abortion which has its therapeutic causes. Now, these causes can of course be related to the mother, as well as these causes can be related to the fetal abnormalities and the fetal causes, of course. We'll just basically balance the benefit and the risk ratios, and then we'll just diagnose whether this abortion was therapeutic, whether it was of a legal cause, or whether it was illegal to carry out this abortion. So we'll be discussing all of this in this section. First of all, moving on to the definitions. They are really important just to clear out all the different terminologies in your mind. Deaths of women while pregnant or within 42 days of the end of pregnancy from any cause related to or aggravated by the pregnancy or its management. So here I'll just want to highlight that it is irrespective of the duration of the pregnancy. It can be an early first trimester, a second trimester, or even a third trimester pregnancy. But you have to keep in your mind that we are not calculating the accidental or the incidental causes which are not directly related to these pregnancy related causes. Here we are just taking our point to the pregnancy related causes. Now, in this, basically the pie chart that is shown over here, it's basically just giving you an overview about the severity of this issue. This research was somewhere carried out in 2005. Maybe the situation has improved or not improved during this period, but still just to have a look and just to have the severity, just to know the severity of the issue. It's just giving you an overview that in Africa, this 265,000 women die due to this maternal related causes, and in South Asia, almost 187,000 women die due to this maternal deaths that are occurring in the world. And if we calculate in the other regions, it's almost about 84,000 deaths. So women are dying due to these maternal related causes, due to these pregnancy related causes. And in these deaths, we're not calculating the accidental deaths which are even occurring, and that will just increase these ratios as well. We are just sticking to the pregnancy related causes over here. So there are the direct causes which are related to the pregnancy, and these include the hemorrhage, the hypertension, sepsis, meaning the infections which can relate to these abortions, and the abortion related causes which can be the illegal abortions are basically which you have to keep in your mind because they use the unsafer methods for these abortions. Now, the other direct and the indirect causes are also related in this pie chart. Now, the major portion over here, you just to have a look, it is due to the hemorrhage. So, while you're carrying out the delivery or the miscarriage has been there and the incident has took place, or you're aborting a pregnancy, even that you have the therapeutic causes on your hand, or even it is a legal abortion, still the hemorrhage is the major cause which is causing these deaths related to the abortion. The other major chunk is due to the indirect causes, of course, and this can be due to the accidental and the incidental causes that can occur. And on the other hand, over here, you see the hypertension, which is also known in the medical terminologies as the preeclampsia and the eclampsia. So, over here, the direct causes, the definition will relate to the deaths resulting from the obstetric complications of the pregnant state from the interventions, omissions, incorrect treatments, or from a chain of events resulting from any of the above. So we'll have to keep in this mind. And this is basically the causes I've already discussed, and we'll keep all these causes in our mind. Now, relating to the indirect causes, the deaths resulting from the previous existing disease or disease that developed during pregnancy and which was not due to direct obstetric causes but aggravated by the physiological effects of the pregnancy. These causes again include all of the other causes, but still they're aggravated. We have to keep in our mind that they're basically on the backhand, it's basically the physiology of the pregnancy, but they're not directly related to the obstetric causes. Now, the late maternal deaths are basically, how do you define them? They are the deaths occurring between 42 days and the 1 year of after abortion or the miscarriage or delivery that are due to the direct or the indirect maternal causes. So the causes would be the same, that is the hypertension, the infections, the hemorrhages, etc. But the time duration will be a bit delayed in these type of causes. The pregnancy-related deaths, again, the deaths occurring in women while pregnant or within 42 days of the termination of pregnancy, irrespective of the cause of death. And here you can see the highest percentages goes to the pre-existing medical conditions exacerbated by the pregnancy, such as diabetes, malaria, HIV, and obesity over here. That is almost 28%. And then the severe bleeding, hemorrhage was the major causes. So it is almost 27%. And then 14% to the pregnancy-induced high blood pressures, and the infections again are very important. That is mostly after the childbirth. They can occur. The blood clots are again very important. Abortion complications, the obstructed labor is one of the minor causes, but it's still there. The statistical measures that we have to keep in our mind are the maternal mortality ratios. How do you define them? It's basically the number of maternal deaths during a given period per 100,000 live births during the same time period. So the maternal mortality rate, we define it as the number of maternal deaths during a given time period per 100,000 women of reproductive age during the same time period. So these are the calculations, and they're statistically important for the research purposes. Now, defining the therapeutic abortion, it's basically the abortion induced following a diagnosis of medical necessity. It can be, again, a pre-existing medical condition. For example, the hypertension, diabetes, they can be aggravated by the pregnancy. And if we have to weigh the risk and the benefit ratios for the maternal census, and we'll just calculate whether the life of the mother is in danger or not, and then we'll carry out these therapeutic abortions. So in this section, basically, we dealt with the basic terminologies and the definitions relating to the maternal deaths associated with pregnancy. That was the end to this section. Thank you for watching sqadia.com.